Welcome to the third and final poster session. I think it's the sixth now of our conference. We'll have 18 presentations over the next 30 minutes, each for 1 minute. And then the bell will come. We'll move on to the next presentation as we've been doing. And at the end of these presentations, you can go to the breakout rooms you want to visit to talk to the presenters about their posters. Now, before we begin, I'd just like to compliment our poster presenters and the quality of the posters we've seen and will no doubt see today. It's been a great challenge to fit as many poster presentations and oral presentations into Academy Week. We have 98 presentations overall this week. The scientific committee, which I chair, really had a hard time selecting that from 300 submissions, but an even harder time assigning them to posters and oral presentations. And we recreated our old tradition of these flash talk poster presentations to ensure that every presentation had a real in-person aspect to it, so you could see the people giving the talk. So I hope that's worked. And when you fill in your feedback forms, please let us know how you think that went. So that we can do it best next year as well. Over the 3 days, every day we voted for a favorite poster, and at the closing ceremony at the end of today, we shall provide awards for the best posters. So let's begin now. Our first presentation is from Celia Burgaz from the Free University of Brussels in Belgium on the effect of food system policies on nutrition, nutrition-related inequalities, and the environment. Over to you, Celia.
Thank you very much. At the first step, what we decided to do is that we collected information from 23 different sources, reports, international recommendations and guidelines. And we collected a total of 46 good practice indicators. And what we did with that is that we divided them into food supply chains in domain and food environment ones. And we collected a survey among international policy experts from different countries in the world. And we asked them to assess if each of these good practice indicators had a positive impact in the outcomes that we were analyzing, that were nutrition, inequalities, and environmental sustainability. And what we wanted to do is to see which ones had the double duty potential, so were effective for preventing 2 of these 3 outcomes, or triple duty potential. Thank you.
Thank you, Celia. Our next presentation is from Teresa Jeremias of the University of Hohenheim in Germany on the costs of complementary feeding diets for Syrian refugee children. Over to you, Teresa.
Thank you. Good afternoon, everyone. So how much does it cost to feed a young Syrian refugee child living in Lebanon a nutritious diet? We used a modeling approach to explore different improved diet models for breastfed and infant formula fed children aged 6 to 23 months. We added iron or multi-micronutrient supplements to see if nutrient adequacy could be reached and costs decreased. We found that all breastfed models were much cheaper than the infant formula models. When supplements are entered into the models, then all improved diets become cheaper. Yet, only for the multi-micronutrient supplement, all nutrients are met for the 6 to 11-month-old children. The older children from 12 to 23 months do not need any supplements. The nutrients can be met by actually including more nutritious foods into the diet, such as meat. In conclusion, action is needed to make nutritious foods affordable for families of young children. Thank you.
Thanks, Teresa. Our next presentation today is by Isaac Agbamafle from the University of Health and Allied Sciences in Ghana on trends in Ghana's food and nutrition security budgets. Isaac.
Thank you and good afternoon, everyone. For this project, we obtained budget allocations and expenditure from the Ministry of Finance in Ghana and assess budget line items for nutrition-sensitive, nutrition-specific, and nutrition-friendly programs. So we observed that from 2017 to 2020, there were fairly stable nutrition-specific interventions and a gradual decline in nutrition-sensitive interventions. However, there were no significant differences in the number of interventions for the various sectors, such as agriculture, health, education, and social protection. We also realized that most of the budgets are approved by the legislative arm of the government, and therefore governmental support is needed for successful budget tracking. And this is important for advocacy for sustainable nutrition financing in Ghana. For more information,
Thank you, Isaac. Our next presentation is from Ankita Model from the ICMR National Institute of Nutrition in India on the impact of solar conduction dryers and nutrition education on dietary diversity. Over to you, Ankita.
Hello everyone. Our study focused on the impact of provision of a low-cost solar conduction dryer along with nutrition education on the dietary diversity of women from subsistence farming communities in rural Bangladesh. The agrarian societies face certain time of the year when the dietary diversity takes a toll. This usually coincides with the monsoon when the food availability is less, food prices increase, and income generation opportunities are less. We provided a solar dryer which could dry fruits, vegetables, fish as well as meat along with nutrition education with the idea to improve the dietary diversity across seasons, especially during the lean seasons. The intervention was well accepted by the community who often referred to it as the refrigerator. The dietary diversity increased by 14 percentage points. And to know more about our beautiful journey in Bangladesh, please visit us in the breakout room.
Thanks very much, Ankita. Our next presentation is by Tushar Dey from the International Livestock Research Institute in Kenya on evaluating bacteria and associated pathogens from traditionally fermented foods. Over to you.
Hello, everyone. This study is about the fermented food safety in traditional fermented food from the northern states of India, which connects to various indigenous tribes. And these tribes again represents various traditional fermented food. And this fermented food plays a vital role in their food security, nourishment, household income, and we wanted to explore the food safety and the other safety aspects in them. And while studying, what we have found is there's a mixed opportunity, there's a mixed picture of which is manifested by wide diversity of lactic acid bacteria with probiotic potential in the one hand. And on the other, we also found like there's a considerable risk emanating from poor hygienic quality due to the presence of pathogens with multi-drug resistant traits. This existence of antibiotic resistant features could put the consumers at risk. And our recommendation was to reconsider the practices on the food safety aspect of this fermented food. Thank you.
Okay, our next presentation is from Christelle Akel of the American University of Beirut in Lebanon. Christelle, I think you're ready to speak now. Over to you.
Yes. So thank you. Hi, everyone. So today I'm presenting our research project that aims to describe the food environment, including food retailers and food advertisement that are available around a random sample of primary schools in Greater Tunis in Tunisia. So first, what did we do? We collected pictures and GPS locations of all food retailers and food ads available within 800 meters of each school. So this was an in-person mapping, and we used a road network buffer. Then these retailers and ads were categorized as healthy, unhealthy, or mixed, according to a NOVA-based classification system, which classifies food based on their processing levels. So what did we find? As you can see in the map, where the predominant color is red, we found that the vast majority of food retailers and food ads around schools are unhealthy. And these unhealthy retailers are more prevalent in the richest area. To know more, please join me in the breakout room. Thank you.
So our presentation is from Siho Ng from the University of Wollongong in Australia on lessons learned from government-led food environment policy processes. Over to you, Siho.
Thanks a lot, Jeff. Greeting to all. I would like to share with you our research on government-led food environment policy process, a systematic review. Our team actually included 142 papers over the last 3 decades covering around the world. And we found that mandatory policy and also policy from very high HDI country dominating. In addition, top cited barrier and also facilitator have been very consistent in terms of the theme that we have identified. For example, industry resistance have been noted as the top 1 barrier during the policy development, whereas the strategy such as policy framing, advocacy, grace period has been noted as the top cited barrier during the policy processes. Overall, these actually create a very critical evidence to inform policy action. I would like to share with you our research full paper on the right-hand side, QR code, where you can access, and look forward to engage with you more in the breakout room. Thank you.
Thank you, Siho. I'm glad we found you in the ether. Our next presentation is from Busi Mazia Dixon of the International Institute for Tropical Agriculture in Nigeria, who will speak on lessons and insights from the Index 24 mobile application. Busi.
Thank you and good afternoon, everyone. We use the Index mobile application, which offers the following advantage over paper questionnaire. It guides the enumerators and respondents through the conduct of the 24-hour dietary recall interview in a structured manner. It also contains modifiable instructions to allow adjustments to the interview process. It allows for real-time data monitoring and checking on the on-site supervisors and remote data managers, and provide instant calorie count for foods consumed as a quick data quality check. The adaptation process includes creating databases for commonly consumed foods, standard recipes, conversion factors, portion size estimation methods, and the food composition database. We leveraged the digital advancements to create a system and dashboard for real-time data monitoring that improved it.
Thank you, Busi. The next presentation today is from Cassandra Ash at the University of Exeter in the UK on assessing trends in food supply and obesity in small island developing states. Over to you, Cassandra.
Thank you. So our work aimed to examine trends in food availability, imports, local production, and the risk of non-communicable diseases in Haiti, St. Vincent and the Grenadines, and Fiji. We extracted data from the FAO and the NCD risk factor collaboration databases from 1980 to 2018, calculated import dependency for all three settings, and used a modified calculation, which considers re-exports. From NCD risk, we collected data on the prevalence of overweight, obesity, and diabetes. Overall, we found a per capita increase in availability of calories, most notably in Fiji and SVG, concurrent with an increase in import dependency, a loss of local food supply, and marked increases in obesity prevalence, particularly in women. These findings highlighted the importance of further investigation to understand the drivers of change in the sources of food supply and their impacts on health outcomes in small island developing states.
Thanks, Cassandra. The next presentation is from Caroline Busiri of the International Livestock Research Institute on foodborne disease burdens in India and Senegal. Caroline.
Hello. I'll talk to you about this importance of food safety. As we know, it's interventions aimed at improving food safety, at improving nutrition are usually hampered by food safety aspects, and the risks that are usually associated can be assessed across value chains. So at each point from production to the consumption at your table. So the study is part of a larger project that aims to understand nutritional outcomes and how they affect stunting and how food safety affects this. So in our literature review, we identified some nodes across the value chains that are key, and some biological and chemical hazards that also.
Thank you, Caroline. Our next talk is from Jessica Williams of the University College London in UK on biodiversity and nature's benefits to people in agricultural areas in South Africa. Jessica.
Hello. Across South Africa, pressures such as climate and land use change are leading to shifts in animal communities. However, what do these shifts mean for nature's benefits to humans? Are the benefits that nature provides resilient to these changes in animal communities? As part of the Sustainable and Healthy Food Systems Project, my co-authors and I investigated the impact of climate and land use change on pollination and pest control within South Africa. We used a novel approach that accounted for species' differing contributions towards the focal ecosystem services, pollination and pest control. We find that future environmental changes will likely substantially alter the composition of ecological communities and consequently have the potential to significantly influence the capacity of these communities to provide pollination and pest control services. The resilience of these ecosystem services differed greatly across scenarios in space. Thank you for listening, and I'm looking forward to chatting to you more.
Thank you, Jess. Now, the next two poster presentations are actually being made by participants attending our watch party here in Brighton by the Beach. So I'm going to step aside and let them speak for their minute, and then we can resume with the planetary offerings that we're getting from others. So let me now introduce the next presentation from Orly Betroff at the University of Greenwich in UK on a tool to predict nutritional post-harvest losses in food crop value chains. Orly.
Hi, everyone. With the recent food crisis due to the Ukraine war and the COVID pandemic, we realize more than ever that we need to make our food systems more efficient and resilient at delivering nutritious food. One of the important elements is the reduction of post-harvest losses. Our project, NutriPilot, has developed a methodology and a tool to predict nutritional post-harvest losses throughout the food system. We worked in 2 different countries, in Uganda and Zimbabwe, and 3 different crops, cowpea, maize, and sweet potato. And now our results have just come out. You see the paper. And we show that post-harvest losses can have a significant nutritional impact on population.
Thank you, Orly. Our next presentation is from Kevin Tang from the London School of Hygiene and Tropical Medicine on subnational perspectives on diets using household consumption and expenditure surveys. Kevin.
Hello, my name is Kevin Tang, and I'm a PhD candidate under the MAPS project at LSHTM. So my research questions how practitioners and policymakers can use household consumption and expenditure surveys to generate insights about how well a micronutrient intervention, like crop biofortification, can help meet intake requirements for populations with the greatest needs. So here we worked with the scientists at the Danforth Center who developed varieties of biofortified cassava elevated with zinc and iron contents. So this study explored a hypothetical, or if the biofortified cassava was maximally adopted by farmers in Nigeria, what are its potential contributions for increasing zinc and iron intake, and how did this vary spatially? So to do this, we ran 3 scenarios representing different crop breeding targets to link this plant sciences research to potential public health implications. So quick analyses like this, conducted on the fly, are features that will be integrated within the MAPS tool. And I look forward to speaking to some of you more in the breakout rooms. Thank you very much. Goodbye.
Thank you, Kevin. Now we move back to the ether. And our next presentation is from Meredith Jackson. Meredith Jackson de Graffenried from Helen Keller International in the USA on consumer food perceptions and purchasing decision-making in Mali and Niger. Meredith.
Thank you. Hi, everyone. We're here today to talk about 2 ethnographic studies that we conducted in Mali and Niger to identify decision-making factors when people go to the market. And specifically, we were looking at perceptions and preferences that drive both consumption and purchasing practices. And we used a cultural domain analysis methodology to do this, which included in-depth shop-along interviews, free list interviews, and in Niger, also pile sorts. And just to give you a bit of a teaser, we found that poverty drives the purchase and consumption narrative, and that cost and value for money are critical decision-making factors in the hierarchy of decision-making factors, but that the value for money differs across the 2 contexts. If you'd like to learn more, we'd like to invite you to our poster session. Thank you.
Thank you, Meredith. Our next presentation is by Thea Ritter from the Alliance of Biodiversity and CIAT on how a nutrition education got lost in a program's approach to improve food and nutrition security. Over to you, Thea.
Thank you. This study is a process evaluation of a nutrition education intervention that was part of a large-scale program that targets over 60,000 households through 36 interventions with the goal of reducing poverty and improving the well-being of vulnerable tribal households in Odisha, India. We used a mixed methods approach that combined focus group discussions, interviews, and a large household survey. We found that the plethora of interventions, lack of detail in design, and failures early on led to nutrition education being left behind as a separate intervention. Instead, it was incorporated into other interventions like home gardens. We recommend that future programs reduce the number of interventions. Moreover, a bottom-up approach in implementation may leave behind interventions with less tangible benefits like nutrition education. Lastly, flexibility and adaptability were key in implementing a reduced version of the nutrition education intervention. Thank you very much, and I hope to see you in the poster breakout rooms.
Thank you, Thea. Our next presentation is by Emily Ferber from Emory University in the United States on landscape analysis of social and behavioral changes in nutrition-sensitive agriculture. Emily.
Yes, hi, good afternoon, thank you. This research aims to explore and describe the landscape of nutrition, social, and behavior change nestled within nutrition-sensitive agriculture programs and projects. And to do this, we've enrolled 13 ongoing nutrition-sensitive agriculture projects and programs in low and middle income countries, and systematically abstracted information by looking through project documents, interviewing project staff, and when possible, visiting the projects in person. Some of our preliminary and initial findings, data collection is still ongoing and much delayed thanks to COVID, but some of our initial findings are that interpersonal communication and varying degrees of community engagement are common. Less common is the use of formal formative research or SBC theories. And a really important key lesson is that community health workers or community frontline workers are a very rich source of skills and information on local customs and norms.
Thank you, Emily. Our next presentation is by Jill Cairns from the International Maize and Wheat Improvement Center in Zimbabwe on the potential contribution of biofortification and other interventions on the adequacy and cost of diets during COVID-19. Jill.
I'm presenting on behalf of my colleague, Frederick Baudron, as part of a project to understand the potential contribution of biofortified maize to reduce vitamin A deficiency on farm across a soil fertility gradient. We conducted a food monitoring study in the dry and main season in rural Zimbabwe. All households, regardless of wealth, were deficient in vitamin A. Actually, and interestingly, the deficiency was greater in the wet season when crops are grown. Using the provitamin A content of biofortified maize grown under optimal conditions in an experimental farm, we estimate provitamin A could reduce deficiencies, but not completely alleviate them, and thus other nutrient interventions are required. Early results also suggest that provitamin A content on farm is significantly lower than that measured on a research station, which will have implications for this research. Thank you, everyone. Thanks.
Thank you, Jill. So our final presentation today takes us back to Australia, and it's from Erica Reeve from Deakin University in Food System Governance in Pacific Islands. Erica.
Thanks, Jeff. Thank you. In this research, we wanted to look at the alignment between the policy priorities of food system sectors compared with the policy tools that were being used to address those priorities. So we undertook a policy analysis of 38 policy documents of food system sectors in 2 countries, and that included the productive sectors, finance, commerce, marketing, industry, and infrastructure. And we used an instrumentation analysis to rank the policy tools by their strength of forcefulness or level of coercion that they elicit. And we found that food system sectors mostly focused on their economic priorities, that is, increasing production, value adding, and greater exports, and they were using stronger, more cohesive policy tools like regulations, financial incentives, and grants to do this. But documents showed that the same food system sectors did have grave concerns for the impact of climate change on food supply and the ongoing environmental degradation related to food supply and for the high double burden of nutrition.
Thank you, Erica. Well, let me invite a round of applause from our UK audience. What an impressive bunch of presentations. Really good. Thank you very much.